Welcome to the Feds, insiders bringing accountability, integrity, and reform to a broken bureaucracy. At Feds for Freedom, we value constructive dissent and healthy debate. The views and opinions shared in today's episode are those of the speaker alone and do not express the views or opinions of the U.S. government or any other employer.
Well, I'm so glad to be here. Thank you.
We've all been to a doctor's office where we've been asked to sign the HIPAA agreement, which stands for the Health Insurance Portability and Accountability Act, HIPAA. We are under the assumption that this actually protects the privacy of our medical records, but in reality, it actually allows more access to certain entities. Would you explain how this works?
Absolutely. Yes. So HIPAA, so a lot of people think that the P of HIPAA stands for privacy, and it does not. If anything, it stands for portability, not only of insurance, but of your data. And so I wrote a whole book about this, Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records, and just showed how the administration and, actually a lot of administrations, but actually the industry, government, data industry, healthcare industry, all of those pushed to have our data to, to pass this law called HIPAA. And there's a section of it that really requires the government to tell us certain things and to have us do certain things, but actually gives them the ability to share all of our data. So that's called HIPAA. And the people who are getting our data not only wanted to get access to our data without our consent, which is what HIPAA does, but they wanted to have it digitized and put into an electronic health record and electronic systems in order to have ready access to our data. Because, if your data is sitting in a medical record that is of paper and it's in a file cabinet somewhere, it's really hard for people to access it. But once all that data has been digitized and made available online through their online, networks like state health information exchanges and the national exchange, which most people don't know about, that's called the eHealth Exchange. Once all of that has been made available, then your information becomes widely and broadly accessible. And under HIPAA, all of these people, 2.2 million entities, according to a federal rule, all of these people can have access to your information without your consent if those who hold it choose to share it. Nobody has to share it, but they can, and they don't have to get your consent.
You're saying the doctors could share our information.
Yeah, the doctors, the radiology facilities, the lab corporations, the hospitals, the healthcare institutions, the health plans, all of those entities have consent or permission under HIPAA to share your information according to how they wish to share it. There are only two required shares. One of them is to you, the patient. They're required to share the information, but even that has its own limits. And the other one is that they're required to share it with the Secretary of Health and Human Services to make sure that they are complying with the HIPAA rule. Of course, the HIPAA rule does not require them to keep the information private and confidential. It really just requires them to keep the information secure.
So why is HIPAA a good thing? What is it marketed as?
So it is marketed as a privacy rule. And so people think that it protects their privacy. During COVID, people said things like, but what about HIPAA? When the government said that employers had to ask what their vax status was, right? And people said, well, what about HIPAA? Because they presume that that's what HIPAA does, that it is a privacy rule. And that is what it's called, but it's really a disclosure rule, telling entities that they can have access, but they are limited in some ways to what they can do with it, or they have to share the minimal necessary. But then who defines what minimally necessary is, right? So this is really a disclosure law. It's a disclosure rule, and it has nothing to do with protecting privacy. It has everything to do with outsiders getting access to your information without your consent.
Yeah. What kind of outsiders would have access or could have access? And what would they do with it? What are the problems with this?
Well, there are, of course, all the standard outsiders. Like you go to, Dr. X, right? And if you expect Dr. X to keep all of your data within the four walls of the clinic, then you have an inaccurate expectation. Because the government has asked if they see a Medicare or a Medicaid patient or an Obamacare patient, the government wants them to send in certain statistics, which they call quality metrics. So, for example, I think it's good to use the vaccine example. So, one of the quality metrics for a long time has been the flu vaccine or having like a certain percentage of all the children in the clinic to be vaccinated. So when parents say things like, I don't want to vaccinate, I don't want to give my children all of these vaccines at once, and the doctor is pushing me into it, and I'm getting pressure every time I go, and the doctor's saying if you don't comply, I'm going to oust you from the practice. What does that come from? That comes from the fact that the government has said there that a certain percentage of the children need to be vaccinated as a score, as a quality score of the doctor. And if they don't have a good enough quality score, they can actually lose access to dollars. So dollars can be withheld from them by the government or by the health plans. So that's why there's all this pressure. It doesn't come from maybe even that the doctor thinks the child needs the shot, but for the sake of their practice to get all of the dollars possible, they will push to get the
Mhm.
child vaccinated. So this is just one of the ways that the data is shared.
Mm. Are you saying that that policy when I myself, my children were fired from our pediatrician
Mm,
because I would not adhere to the childhood vaccine schedule,
mm.
and they said, "Fine, you're out of the practice." And I said, "Fine, great, I'll find someone else."
Mhm.
But are you saying that that stems from HIPAA?
I am saying that stems from the quality requirements of Medicare, Medicaid, and the health plans. And
Okay.
because of HIPAA, they are allowed to have this kind of quality metric or this kind of rule, and then allowed to share that information without your consent. And so HIPAA allows the sharing that allows them to create the quality metrics and then allows them to tell you you're out of there because you're not complying and you're causing our quality score to be less than we need it to be.
Why should this be so concerning to the average American? I mean, we're in the age of information. All of this information is out there. There's the cloud. We've shared our stuff on our Apple phones. We don't know where the information is going. And some have shut off any concern. Like they're just saying, well, it makes my life easy. But why do you say the average American should be concerned about this?
Well, the average American does not see behind the scenes. And so, from their perspective, they think HIPAA protects me. I can say anything to the doctor. Nobody's going to get access to that information. And so, they have been calmed. And actually, this is what part of the HIPAA uh, rule was meant to do. So when you go to the doctor's office and they say you need to sign the HIPAA form, a lot of people, when you ask them what does that mean, they will say that what that means is that my information is held between me and my doctor. Nobody else can see it. But they haven't actually read the Notice of Privacy Practices, because what they're saying when they sign that statement is they're saying they've either read or they've received or they've understood the clinic's Notice of Privacy Practices. And they have made an assumption that because it has the word privacy in, that they don't have to read it because, of course, everything is protected. But that's not true. When they read it, they will see that it is a notice of disclosure practices. But by signing it, really, those who wrote the rule, those who wrote the law, they have all convinced the American public that all the medical information, their behavioral information, if they've got abuses of any sort or whatever you might talk to a doctor about or whatever diagnosis a doctor might give you, they are convinced that this is all private, but it is not private. And so this is what we call, like this deliberate deception of the American people. Because one of the statements that we say, to answer your question, he who holds the data makes the rules. And so this is what every tyrant in the entire world knows. They have to conduct surveillance on their people. Well, between HIPAA and the government mandated electronic health record that digitized all of our data, health surveillance and surveillance of the patient, surveillance of the doctor has been, enabled. It's really simple now to look at, every patient and see everywhere that they've gone, everything that's wrong with them, comments that they've said, who's in their family, what's their family genetics, all of this sort of thing. This has become a huge profiling system. And that profiling system is only going to get larger as there become fewer and fewer electronic health records. I don't know if you're interested in this, but when the electronic health record was mandated by the government, and it was mandated, that thing is not in your doctor's office because they wanted it to be. It was an unfunded mandate. It forced all sorts of doctors to give up their practices to become employees under somebody else's control. And so increasingly, Epic is the healthcare system, and I think Oracle is the other one. I'm sorry, the electronic health record system. Those are the two biggest ones. And as that consolidates, then we will have a socialized health data system. We will have a consolidated singular data system, which is, I believe that's why it was put in place, to get to a socialized healthcare system. Because if you don't have all the data, you can't really control what happens in the exam room. But if you do have access to all the data on all the patients and all the doctors and where they go and when they go and who they see and what their diagnoses are, then what you have is control over the doctor and control over the patient. And over the patient in ways that the patient won't even understand. They won't understand how, because of their entire health history, only certain things become available on the electronic health record for the doctor to do for them. So the doctor has to choose from a menu of items, and now between AI and corporate treatment protocols on the computer, that what they can do for you as a patient has become limited. And a lot of doctors, they don't critically think like they used to think. They go to the computer, they put in the diagnosis, they see what pops up on the menu of items that they can do for you, when they should be thinking about like other things, like during COVID, right? Ivermectin was taken out of the electronic health record. If it was there, it was taken out. It was taken out of hospitals. It didn't even become a thing that they could choose to treat a patient, even though it would have given life and saved the lives of so many patients. And this is what people have to know about their data and how it can be used against them and used to control their doctors.
And when were these electronic records mandated?
It was mandated as part of the American Reinvestment and Recovery Act, or Recovery and Reinvestment Act. And so that was in 2009. Obama signed it exactly 4 weeks after he was first in office. And in my book, I have certain comments about how they saw that this was the foundation for the Affordable Care Act, what became the Affordable Care Act, which was passed the next year after that.
Yeah, I'm glad you gave the example of ivermectin, because this is the manifestation of the symptom of this these digitalized records. Now, does AI, or can AI play a role in this? Can it further the harms of digitalized records?
Well, I think it's interesting. Right now, doctors talk about the AI systems hallucinating. That's the word for it. And it means that everything might look really good for a while. And for a trained physician who really knows his or her stuff and have been well trained not to follow protocols, but to actually think and have a lot of experience, they can see the errors that happen. And so like this one physician said, in an article, I think the title was something like my AI lied to me, or my computer lied to me, or something like that, right? And it went along really well for a while, and then it just started like saying these different things. And so the AI was bringing in information from sources as though it was truth, but he as a physician knew that wasn't the right way to treat the patient. And so every doctor has to be very, very careful. And the real question is, are you going to have a doctor who knows how to tell truth from lie when it comes to AI? I don't actually know, because nowadays the health plans have gotten into the medical education business. So they are training their doctors to be essentially government or corporate socialism doctors, because that's what we call a health plan, is the corporate version of socialized medicine. So they're training their doctors to be managed care doctors, to be health plan doctors, to be government protocol doctors. And we need doctors who are trained to be real doctors, not to follow the protocols, but to actually think, know symptoms, understand the patient, listen. You've been to a doctor recently, or if you've been to a corporate doctor, and do you have 5 minutes with them, 8 minutes? Maybe you don't even get a doctor, right? You get a PA or an NP, right? Who haven't been trained in medicine. They have no medical certificate or medical license. They don't have one, right? And they're just following the computer. And sometimes the PAs and the NPs, because we've seen them, will go to Twitter or Facebook and ask their colleagues and say, "Hey, I got this going on. What do you think this is?" Because they have not been trained in medicine. On the other hand, you've got doctors who have only 5 minutes. They've got these protocols to follow. They don't listen to your whole story. If they listen to your whole story, would they do something different? They don't have time, right? Because they're punching in all of this data. This is what's taking up their time. I think a study showed that something like 60% of their time is on keeping the medical records, doing the quality metrics, everything that they need to get paid. And the other 40% of their time might be with the patient. And some studies say even less. And so this is, it's really, I think it's a dangerous time to be a patient. I am glad that I am a nurse, and so that I can see through some of this, and I know information. I know better what to come into the situation with. I know better how to protect myself. I know to bring questions in to ask the doctor and never set down the pencil. And that's what I tell people to do. Never ask the questions, never set down the pencil, because then you'll have a hard time picking it up. Get all of your questions answered. Some of them don't even like that. I know this is a little bit aside, but this question has just caused me to think about the stories that I hear. People who come in for, let's just give you an example. They come in because they've got a toe that hurts, but they also have something else going on, and they just want to ask a question about that while they're with the doctor, right? And the doctor will say, "I'm sorry, you need to come back in for a different appointment to handle that question." Or they will be charged for a second visit at the same time of the first visit. So this is not medicine. And so when our organization says that the mission of medicine has been taken over by the business of healthcare, this is what this is. You should handle the questions of patients at the time when the patient wants to ask you, because whatever they're asking you about could be bigger than what they're actually coming in for. It could lead you to realize that they have a cancer, or they've got a this, or they've got a that need immediate attention. But if you're not going to listen, who knows when the next time is that they're going to be able to ask the question.
That's right. Oh, Twila, this is excellent information. Thank you so much for this. With, going back to HIPAA, is there any way for a patient to opt out of the HIPAA agreement?
Yes, and I would just say that your listeners should listen carefully, because whether you sign or you do not sign, it will not change anything unless you are in a state that has a stronger state policy law. If you have a stronger state policy law, it supersedes HIPAA, and then you have some actual rights. The real reason that you should not sign the HIPAA form, and we have an entire campaign to get people to not sign the HIPAA form. The real reason is it is a massive deception foisted on the American people. Signing the form is the tool of that deception. You do not want to participate in exacerbating that deception. And then There is no law that requires you to sign it. And in fact, HHS says on their Notice of Privacy Practices website, by law, you are not required to sign this acknowledgement statement that you have received or read or understood the Notice of Privacy Practices. And then the last thing is that when you say something and it's really confidential, and then somebody like the clerk, when you call up for your next appointment, says that thing back to you, and you thought this was going to be heard only by the doctor, and then you get angry, then they will wave the HIPAA form in front of you and say, you said you read, understood, or received it. So you should not have said that piece of information because you should have understood all the different places that we could share that information. So it's really your fault that you even told us.
Do the doctors understand the deception?
I think everybody in the office sort of understands the deception because they see where the data goes and they have to send the data to a variety of places, but they're just trying to follow the protocol and they don't want to be charged with a HIPAA violation. And this is sometimes why they will tell a patient who refuses to sign that you cannot have an appointment today, which is why we have two things for all of your listeners. On our homepage at cchfreedom.org, toward the bottom, we have something called Helpful Handouts. They need to go to Helpful Handouts, click, and find our discharge instructions. We are discharging you into the world with instructions that when you go to the doctor's office, you can protect yourself. And so that's helpful. It shows 5 different ways to refuse to sign the HIPAA form, amongst other things. 12 different questions to ask your doctor. Maybe it's only 10 questions, but it's a variety of things. But the other thing is, you got your phone. When you get that handout, it will show you the actual place where HHS says, by law, you are not required to sign this form. What I do now, it's almost like the guaranteed way to get no pushback. I just put that URL into my phone. I have the HHS website right on my phone, and I come back with my paperwork or my iPad to them, and I say, I am not signing the HIPAA form, and by law, I don't have to. And here, take a look. I just put it right in front of them and say, right here, HHS website, see that? And it says, by law, I am not required to sign this. And you, as the practitioner or the clinic, the 4th bullet point is that you are the one who has to pick up the pen and say that I refuse. I don't have to do anything. And so that one is not yet on the discharge instructions. We've essentially just discovered how beautiful this works, and we will be adding it, but for right now it's not. So I'm just telling your listeners about it.
Excellent. If you know your information is already being used, it's already been given to other entities, is there anything that the patient can do to take back that information? I mean, this is the big problem now.
Right.
All of this information is out there. Is there any way to recapture that and truly to make it private?
There is no way, once the information has been shared, you don't even know. You don't even know where it's all been shared. We have tried to get audit logs so that you would be able to find out exactly who got it and for what purposes. But so far, we have not been able to get that. And so you can certainly ask your state legislators to actually give you a state medical privacy law that supersedes HIPAA, like we have here in Minnesota. And we do have a legislative library of model state legislation, which is on our website. So people can come and get that. They can certainly contact us if there's a state legislator that wants to do this. Well, feel free to contact us. We will show them, sort of the key elements. We'll give them our, model state legislation. They can just get it right off of the website. But as an individual, about the only thing that there are 2 things, I suppose, to do. One, carefully think what you're going to say. And this is a terrible thing in the exam room, speaking as a nurse. You want the patient to be frank about absolutely everything because it will determine the diagnosis and the treatment. And if they're not frank about everything because they're scared about something, you may treat them wrong if you're the doctor. And so we need truth and honesty, and the exam room should be a sanctuary for the patient. But nowadays you have to be careful. What are you going to say? And then the second thing is HIPAA does say that you can request that they not share certain information, but they are not under law required at all to agree to your request. And I guess the third thing is you can pay by cash rather than through your insurer. And then your insurer cannot get access to that information if you pay by cash.
Hmm. Hmm. I have one more question before we go on to real IDs. What are the states whose medical laws supersede HIPAA?
Minnesota.
Is that it?
That's really it. There are little provisions that other states have, like I think Chicago has a pretty strong biometric or biological law. And we helped Montana to write and pass a law that protects genetic privacy. And that is the strongest law in the entire nation. But Minnesota has the strongest state, just medical privacy law in the country. Yep.
Why is that? Did you have something to do with that?
Well, before I got involved, even though, probably about 35, like I've been doing this for 30 years, but probably about 35, 38 years ago, there was a single citizen lobbyist in the state of Minnesota who helped to get this law into place. And then we have truly had to protect it from the Chamber of Commerce, from the industry, from the researchers, from all sorts of people over the time. And so for the last 10, 12 years, there's really been a barrage of interest in HIPAAizing our Minnesota law, which means getting rid of it, right? And so we have had to protect it. But we have used Democrats and Republicans, whoever's in charge, because it's really a bipartisan issue, and we have managed to protect it.
That's right. Medical freedom is a bipartisan issue.
Yep.
We're hearing over and over again that starting in May, we cannot fly without this new real ID that we're all required to get. Could you give us a brief overview of what real IDs are marketed as and how the idea of real IDs even came about?
Yeah, so the real ID is, in truth, it is a national identification card. So it's a national ID. It is not a state ID. If you have it in your pocket, you've got a star, or if you're in Washington State and it's got a flag, it is a national ID. It is under federal control. And so here's the history of it. And it's marketed as nothing but, increased security of a state driver's license. That's how it's marketed. But the history is in 2005, without any committee hearings, as we understand, and in the middle of the night, and on a tsunami bill. It was a national security, but it had to do with tsunamis and other things. Anyway, so in the middle of the night, they passed this bill, and on the floor of the U.S. Senate, Senator Lamar Alexander from Tennessee said, "This is a national identification card." We've not asked the American public about this. I'm not sure I'm comfortable creating a national ID, but of course they did it anyway. And then, some of the things to know about that is what the law says is that it's required for access to certain federal buildings, nuclear facilities, and commercial airlines. But the really important thing to understand about this is that, if your listeners know anything about laws and federal laws and how this works, this particular law has a definition for official purposes. And official purposes are those three things that I just told you. And then it tacks on this phrase, and for any other purposes that the Secretary of Homeland Security shall determine. In other words, the secretary could decide that you needed a real ID to buy a gun, to get married, to open a bank account, to access healthcare services. And actually, we believe, as there's been this great delay because a lot of people have not made their cards compliant, and we want more people. And we'll get to that, I'm sure. But we believe that if they really wanted to impose it on the American public and make everybody submit, they would say you had to have access. You had to have it for access to medical care, because not everybody has to fly. Not everybody
That's
will
right.
fly, but everybody needs access to medical care. So that's one of the reasons a health freedom organization is leading the charge on this issue, because we know it will be no card, no care at some point, because it's something like 49% of all healthcare is funded by the government. And so they could easily say that in order to prevent fraud, we need to have everybody use a real ID or they can't access care. Right. And so anything that you can think of, they could decide that a real ID is needed for. And so it's really this command and control system. It's a surveillance system. It's a national system. And it is a usurpation of states' rights and individual privacy rights. And I think the other thing I should say to you about the history. So 2005, right? They pass it. 2008, they come out with a rule, and that's the rule that still stands. And that's the rule that they are now working toward with these new announcements from the media and from TSA. In 2008, they came out with a rule and they told states to comply. And states stood up and said, I don't think so. This is a usurpation of our states' rights. And 25 states passed laws prohibiting compliance with Real ID. And another 12 states passed resolutions opposing the Real ID. And basically, that's where it sat in 2008 until 2016, when Obama said the "you can't fly" lie, and now they're saying the "you can't fly" lie again. But this was all to try to get legislators to get rid of those laws and get their constituents all worried. And their constituents did get worried, and they heard from their constituents who said, "What? Fix this problem. I have to be able to fly," right? And so they all bowed and they all complied. And now what we have are 100% state compliance. So the states have conformed their laws. But what we don't have, what they don't have, is they don't have card compliance. So at least 44% of the American population has not complied with going out to get a real ID. And nobody has to comply. And nobody should comply. Because if you understand that the Real ID is a national ID that can take control of all movement, all identification, they want to digitize it, put it on your phone, then be able to track through your phone. If you understand the net that is being built here, you will not want a Real ID. And therefore, you don't have to have a Real ID. If you want to fly, get a passport. Get a passport card. Get both of them at the same time. And refuse the Real ID. Don't get the Real ID and turn back in your Real ID. 45 states allow people to turn in their Real ID and get a standard state driver's license, and everybody should do that. And so that's a little of the history. And the other history I think I should add is now we are working with some state legislators around the country who are introducing bills to extract themselves from the Real ID and to leave the Real ID behind, to not conform as a state. And I don't know the success that this will be. Really, the success in stopping this national identification system. It's not just a card. The Real ID is a system. So stopping this system is all about the individual today. We are really thankful for the state legislators, and we're going to help them in any way possible to move in that direction. And the listeners to this program can help them by calling up your state legislators and saying, hey, stop this national ID system. I now realize what it is. But really the power right now is in the hands of the people. And so we want to have not just 44% of the public not complying. We want 46 and 48 and 50 and eventually 60. And let's just turn this thing on its head for them and make it impossible for them to impose it on us all.
Right. I'm in non-compliance only because I was supposed to get my Real ID, not knowing not knowing COVID was about to come, and they were talking about vaccine passports at one point, not
Right.
knowing that this could become a vaccine passport.
Mhm.
Um, but because of COVID, everything was shut down. So I still don't have it. But you're saying you can actually bump up the number of who is not complying by people turning in their real IDs and just
Correct.
getting a regular license.
Correct.
Did you have to exchange your driver's license for a real ID, or are they two separate things?
You exchange. You exchange your driver's license for a
Mm,
real ID, and alternatively, when you switch back, you exchange your real ID for a state ID or a state driver's license.
okay.
Yeah.
All right. Well, there you go. So everyone go turn in your real IDs and get a regular state license. Now, how many states again did you say are now willing to stand up and push back against the real ID?
Yeah, I haven't said that. I know there's
Ooh.
at least 7 to 8 states where there are bills to extract themselves, to repeal the law that conforms with the Real ID Act. So
So
I know that,
7
but
states.
we're working for more. We're working
Mhm.
for more. And there are only 5 states where you cannot get a standard driver's license, and they are Texas, Florida, Georgia, Wyoming, and Mississippi, which is amazing, is it not? All those
What?
conservative states. So people in those states should actually talk to their legislators and say, hey, what are you doing putting me into this national ID system? Give me the right to get back to a standard driver's license. And so
Absolutely.
yeah, so people have to hear that. And I encourage people to go to our special, it's part of our website, but we have a special URL to deal with this issue, and that is refuserealid.org. Refuserealid.org. And it will give you a short history, and there will be some active engagement buttons so that you can contact Congress and tell them, stop this thing that is going to be starting on May 7th. Which reminds me, I never did explain May 7th. And I really do need to explain
Oh,
May 7th.
do, please.
So May 7th is their deadline for everybody having a real ID, but not really. It's like an artificial deadline because what their new rule says, it's a progressive enforcement rule. What their new rule says is that May 7th is the start of progressive enforcement against those who do not have a real ID compliant ID. So if you go with a passport, no worries. If you go with your driver's license for the next 2 years after May 7th, it would appear, according to what the rule says, I just finished reading the whole rule. It would appear that what's most likely is that every time you go, they will give you a sheet of paper that updates you on the deadline 2 years from now. Not certain. Every state and every airport is allowed to do whatever they want for progressive enforcement, but they do have to tell the Department of Homeland Security what their plan is. And so, but they said that if they do 3 strikes, you're out, which was one of the ideas that TSA gave to airports, they would have to collect all of this information wherever that person was flying, and they'd have to put it into a big data system so that they knew when the person's 3rd strike was. So they really do not think
Oh.
that that's going to happen. And so what's likely to happen is it's just another one of these you can't fly lies to get everybody to run into the system, while they actually extended it 2 years. And the AG in Illinois just put out some article or something. I haven't read it yet because it's behind a firewall, but he's basically saying, is it really a deadline? Because, of course, there's 2 more years.
Do you think that the real ID will actually be stopped, or are we in for a greater surveillance state in the next 5 years?
Well, it's us against them. It's we the people against the government. And so the TSA administrator, you know those cameras at the
Yes.
airports, right? Everybody should refuse, absolutely
Yes.
refuse. And you can opt out and don't even go up to it and look at it anyway, because it seems like they may be taking pictures of people in line, according to one thing that happened to Senator Merkley. I'm not certain if that's what happened or they had saved it from before. Anyway, don't do it. And just say, I'm opting out of that, and just like avoid even looking at the thing. But the TSA has said that eventually they will require biometrics for everything. Now, this is the use of your body to control you, to identify you. And so it's really we the people against the government. And so we know where they want to go. And we know that they want to digitize everything. Nobody should digitize their ID, their driver's license. Nobody should allow that to be done. Idaho, I believe, just passed a law saying that they can digitize IDs. Everybody should refuse.
Hmm.
And so the movement is on. And just one little story about that. We did a report on IDEMIA. Nobody else has ever done a report on them. But if you come up to the TSA agent at the airport, look at all the equipment that surrounds that whole process. It says IDEMIA on it. And IDEMIA is looking forward to a future where we don't have any papers. We simply wave our palm, look into our iris into a camera, and just walk through the airport, with our fingers and our palms and our faces and everything. And so this is something you cannot change. You can't, well, I suppose you could have plastic surgery, right? But really, this is the idea of your biometrics, your body parts being used to control you, to track you, to conduct surveillance, etc. And we must all stand up at every junction against this. It would be better for people to not use credit cards. It would be better for them to eventually have not a smartphone, right? We have to make decisions as to what we will do because the tracking is all there and it's all being expanded.
How and why did you get involved with this health medical freedom movement?
Well, I got involved when I saw that the Clintons wanted to take over the healthcare system through, back in 1993. And I just felt like I was being called to stop what was going on here because I thought if they take over healthcare, they will take over the country. And of course, during COVID, that's exactly what we saw. And so, I've been doing this for 30 years. I've had, I started an organization out of nothing because I felt called, and I feel like God. I'm a Christian. I feel like God, made this happen. And so, freedom is essential for all of us. It is a right that we have by birth, as the Constitution says, given to us by our Creator. And then I'm a nurse, and I knew that if they could control what kind of care that you could get, and I knew they could use the data to control what you could or could not have and can and cannot have, that all of this is about taking away all of our freedom and changing America into a country that it is not supposed to be.
Besides public awareness, what is your organization doing to further medical freedom?
Sure. So I like to say that we are engaged in high level policy engagement and practical tools, on the ground tools for the American people. So some of the things that we have done that are really helpful to people above and beyond at the legislative level. So let me just say the legislative level. In Congress, we are trying to get the Retirement Freedom Act, the right to opt out of Medicare without losing your Social Security. The Clintons tied those two together. No law, no rule, no nothing. And so people will lose their Social Security if they don't enroll in Medicare. But if we can't get rid of Medicare, we will never have health freedom in this country because Medicare controls everything that happens in the exam room, unless you have an independent doctor who doesn't take Medicare. And so we're trying to get the Retirement Freedom Act to pass. We're trying to get a bill that we call Make Health Insurance Real again, so that we have real health insurance. The health plans are the corporate version of socialized medicine. Real health insurance is for catastrophic and insurable events only, and everything else goes to cash, and then the prices come down to cash as well. And then, of course, real ID. And so we've been trying it at different levels, to stop the TSA rule, and we're still at that. But when it comes to the tools that we give people, so it's our discharge instructions, We have a new Medicare how-to guide that a federal official told me is a real service to the American people. It has things in there that no one else has, including 10 Medicare traps to avoid. So if you know somebody who's going into Medicare, or you've got parents in Medicare, or you've got people who are about to go in there, this is a great guide. It's right on our website. It's for free. We will very soon have a handout about how to switch from a real ID to a state ID. So actual steps to get you back into a standard driver's license. We'll have another handout related to how to know if your doctor is independent or not. And we have the Wedge of Health Freedom at jointhewedge.com, which is our directory, our nationwide directory of cash-based practices around the country. And they don't take government, they don't take insurance, they just take cash. And so they are a doctor who works for you. And eventually we want a cash-based hospital and more than one cash-based hospital. And then we can get back to affordability and prices and confidentiality and everything that healthcare is supposed to be for the American patient.
That's excellent, Twila. You're doing so much. I've been on to your service. It's called the Wedge, correct?
Yeah.
And I was looking up in my area all the doctors that are cash based, and I actually saw Dr. Erica LeBaron, who is out of Richmond, Virginia. She's actually going to be one of the speakers at our conference in a couple weeks.
Oh, wonderful.
So it was neat to see that connection. Where can people find you?
Yeah, so they can go to cchfreedom.org. That stands for Citizens Council for Health Freedom. So cchfreedom.org. And of course, I'm on Twitter. We're the organization's on Twitter, and I'm on Twitter under my own name, and the organization under CCH Freedom, and on Facebook as well, and Instagram, I believe.
If the average American citizen could do one thing to protect their medical freedom, what should they do?
The best thing is to find a doctor who works for you and to realize that cash is the way to freedom. So that's probably the first thing. Get out of the insurance mind. Actually, get out of the health plan mindset. Get out of the government mindset and help the doctors who are out there trying to not only survive, but thrive, because that's the way that we will get back to a system that's really all about the patient and the doctor, affordability, confidentiality, and no outside interference. They have to start changing their mind. They have to see what's possible, and they don't ever have to accept the prices of today, because those will not be the prices of tomorrow when we have a truly free market cash-based system.
Oh, that's a good point. Well, Twila, thank you so much for joining me today. It was wonderful to meet you.
It was great to meet you as well. Thank you.